Imagine a scenario where the very systems designed to keep us cool during sweltering heat waves are turning into hidden threats, spreading a dangerous disease through the air we breathe. In parts of Upper Manhattan, residents have found themselves facing a chilling reality. Their air conditioning units, meant to provide relief, have instead become breeding grounds for Legionnaires' disease. Since July 25th, at least 67 people across 5 zip codes in Harlem have fallen ill after inhaling contaminated air from poorly maintained cooling towers. This outbreak has resulted in 24 hospitalizations and 3 fatalities, making it the largest in New York City in a decade. Health officials predict that the number of infections could rise further. But here's where it gets controversial. The city's response has been swift. With all cooling towers in the affected areas sampled and treated, Mayor Eric Adams provided an update via video, assuring residents that action was being taken. However, some experts question whether more could have been done to prevent this situation in the first place. Legionnaires' disease, named after a group of American Legion veterans who fell ill in a Philadelphia hotel in 1976, was once rare. Today, it's becoming increasingly common across the United States. According to the U.S. Centers for Disease Control and Prevention, cases have surged by 9-fold since 2000, largely due to rising temperatures and humidity levels associated with climate change. When you have extremely hot environments, our infrastructure is struggling to keep up, explained Gene Grassman, an associate professor at the City University of New York, Graduate School of Public Health. This outbreak highlights how our cooling systems, like many other aspects of urban infrastructure, aren't designed to handle such extreme conditions. The bacteria responsible for Legionnaire's disease, Legionella, thrive in water temperatures ranging from 77 to 113 degrees Fahrenheit. If cooling towers are not regularly cleaned and maintained, they can become ideal habitats for these microorganisms, potentially spreading the disease through the air. The Northeast experienced intense heat and flooding in late July, driving up air conditioning usage and seemingly the likelihood of bacterial growth. This perfect storm of factors may have contributed to the recent outbreak in Harlem. So, what exactly is Legionnaire's disease? It's a severe form of pneumonia caused by Legionella bacteria. Unlike the flu, it's not contagious from person to person, but can affect groups of people exposed to the same contaminated air source. While the disease can be effectively treated with antibiotics when diagnosed early, its symptoms, fever, cough, shortness of breath, often mimic those of the flu, leading to delayed treatment in many cases. Historically, Legionnaires' disease outbreaks has disproportionately affected lower-income and non-white communities. The current outbreak in Harlem, a predominantly black neighborhood, follows this pattern. Dr. Tyler Evans, a former New York City health official, noted that these communities often have higher rates of chronic health conditions, such as asthma and chronic obstructive pulmonary disease, which increase the risk of complications from the disease. According to Dr. Michelle Morse, the acting city health commissioner, other high-risk groups include older individuals, smokers, and those with pre-existing lung issues. She advised residents in the affected zip codes 10027, 10030, 10035, 10037, and 10039 to remain vigilant for symptoms and seek medical attention promptly. The health department emphasized that residents should continue using air conditioning and other water-using appliances, as these are essential for maintaining health and safety during extreme heat events. Dr. Barun Mathema, an associate professor of epidemiology at Columbia University Mailman School of Public Health, called for improved maintenance of urban infrastructure, particularly cooling towers, to prevent future outbreaks. "We built these systems," he stated, "and it's our responsibility to ensure they function safely." This incident serves as a stark reminder of the critical need for robust infrastructure management in the face of a changing climate. As we continue to experience more frequent and severe heat waves, it's crucial that we address these vulnerabilities before they lead to further tragedy.